It's not the fantasy football season, but we did have a major injury in the NBA that I figured was worthwhile to cover. Victor Wembanyama, he ended up having a blood clot in his shoulder. And the thing about it is that blood clots, they hold you out for a pretty long period of time. They already said he's out for the season. What could have caused it? A lot of people are talking about this possible injury called thoracic outlet syndrome. You can see that subclavian artery right there. It can get pinched between that clavicle and that first rib. And that can become an issue, especially with tall, slender individuals, with repeated compression of that vein because it causes an issue with the blood flow. It makes it more turbulent and it makes it a higher risk of creating a blood clot. Blood clots are concerning because they can progress over to the lungs and cause possible lung blood clots, as we've heard from Chris Bosh's issues in the past, and I'll go over that as well. The thing is, we can't just say that it's thoracic outlet syndrome. There are a couple different treatments for it. You can see that muscle right there that's highlighted, that's the anterior scalene. They can remove that muscle because you can see it can cause a lot of pinching on that vein. Another thing they can do is they can remove a section of that clavicle or a section of that first rib. But those are pretty significant surgeries, so they really want to make sure that it is thoracic outlet syndrome before they progress to that kind of treatment. Now let's talk about the major causes of deep vein thrombosis, or DVTs, blood clots in the veins. The biggest factors are stasis. So if you have prolonged immobility, like you're in bed for a couple days, you take a cross transatlantic flight for 15, 16 hours and you don't move, those are all big issues for developing a blood clot. Trauma is another thing. So you take a direct blow to that area, causes trauma to that blood vessel, also causes an aggregation of clotting factors and can cause a blood clot to form. The other ones are infections or cancer. These are obviously a little bit less common and they require a pretty extensive workup to determine the cause. And the last is genetics. So the issue with diagnosing a blood clot is that it can be so many different options, and right after the person gets diagnosed with a blood clot, they pretty much get immediately put on blood thinners, which messes up a lot of the laboratory testing you would do in these situations to rule out a genetic cause. So when Wembanyama has been put on blood thinners, how long does he have to be on blood thinners for? Pretty much they're going to treat this initially as a provoked DVT without him having likely any kind of significant past medical history or past history of blood clots. And they're possibly going to call that it's possibly thoracic outlet syndrome, so they'll keep him on anticoagulants for 3 months. After that, they can wean him off those anticoagulants and start the extensive workup to rule out any kind of underlying cause for blood clots. Once they can rule out any significant genetic cause or something that will put him at a high risk for having another blood clot, then they can talk about, if it is thoracic outlet syndrome, should he have a more definitive treatment than the initial physical therapy, which is what they do typically. But if he has a constant repetition of that overarm movement, he's a thin individual, he's a high risk for that blood vessel getting occluded again, they might choose to go with one of those 3 surgeries we talked about earlier. What's the risk of a blood clot coming back in thoracic outlet syndrome? So the overall risk for an untreated thoracic outlet syndrome recurrence is about 20 to 30%. That's pretty high. But when you do that scalenectomy or clavicle resection or a first rib resection, then that risk goes down significantly, because you can imagine if you're not compressing that blood vessel as much, you're not at nearly as high of a risk for a blood clot. Now, a lot of people probably remember Chris Bosh. Dominant player who unfortunately his basketball career got cut short because he had multiple blood clots. His blood clots were a little bit more significant. He had pulmonary embolism, which is different than a typical DVT. A pulmonary embolism is a blood clot in the lungs. Chris Bosh ended up being ruled out because they ended up working him up for those genetic causes, and he did end up having antiphospholipid syndrome, which places him at an extremely high risk of having repeat blood clots and makes him have to be on blood thinners lifelong, or at least for an extremely extended duration period of time. And unfortunately in the NBA, you can't play on blood thinners, and you can imagine, because if you suffer an injury where you stop bleeding and you're not able to stop the bleeding because you're on blood thinners, well, that's an extreme risk of extreme injury or even death. So overall, what does that mean for Victor Wembanyama? Does that mean that he's going to be able to come back and play? Does that mean he's going to be out for the rest of his career? I'm optimistic that they're going to find that this was a provoked DVT due to thoracic outlet syndrome, and they're going to be able to provide treatment for that, allowing him to return back next season. Now with his body habitus, that extremely long, lanky physique with the long fingers, they're obviously going to have to rule out genetic causes. There are some conditions out there that make you at a higher risk. Ehlers-Danlos, Marfan, just to say a few. That's not to say he's got any risk of those, but that's just to give you a broad idea of the kind of conditions that they really need to work up, including antiphospholipid syndrome, factor V, all these kind of things. Once they rule that out, they should clear him to return back to play. Assuming he doesn't have any other recurrences of blood clots, that should be it in terms of safety for the rest of his career. So don't freak out, don't get overly concerned. I think Victor's going to be out for this season, obviously, but he should be back next season.